Should we start? Thank you. So, dear colleagues, it is time to think of living the very active, efficient, lively, and a bit exhausting gathering. I will not make my own summary of the Marseille EPH meeting. I enjoyed the session I could attend, not enough, and the interactions with colleagues from many diverse places, not only European regions, but also North Africa and further. I have to say that I was really happy seeing so many of my French colleagues, from whom, from what I heard, they found it very inspiring to meet with European colleagues, and so easy at the same time, as we know. I also heard from some non-French professionals that it was very rich for many to see better what France is doing. You know, as a usual audience of UFA, that in many previous meetings we were 30 to 50 French professionals attending the meetings. The figure was 500 for this meeting. I hope it will be a serious option for the future for my French colleague to attend the next UFA meetings. When discussing the location, Marseille created some concerns, as it is much less well known than Paris or Lyon or Strasbourg, although it is the second city of France by number of inhabitants. But I insisted, I'm very happy to have done it, and I hoped you enjoyed this city with its real opening on the whole Mediterranean Sea. Therefore, Marseille and its history are, by nature, incentives for bridging with territories bordering the south of the European region. I will stop here my conclusion. I will finish with one touristic advice. You have to explore Marseille again one day without strong rain. But I can tell that entering the Palais de la Bourse, like it was yesterday for dinner, was a privilege. I'm not sure it can be granted again easily. Now let me handle my place and the microphone to our speakers for the closing ceremony. The first speaker will be Dr. Patrick Padovani, Deputy Mayor of Marseille in charge of health and member of the WHO Healthy City Network. He will say a few words before we leave his city, and thanks to him for the continuous help that the city provided to us. Patrick, you have the floor.
Bonjour à tous, et d'habitude on fait un discours en disant bienvenue à Marseille. Donc comme on est aujourd'hui sur une conclusion, je dirais j'espère que Marseille vous a bien accueilli, j'espère que vous avez été heureux de participer à ce congrès dont je voudrais féliciter l'ensemble des organisateurs pour la tenue des ateliers, la tenue des thématiques, et aussi pour avoir choisi Marseille, bien sûr.
Do you need translation? Well, for some who need, because we want to be inclusive, I won't do it in deaf language sign, which could be something interesting, but at least I can do it in English. So Patrick Padovani, Deputy Mayor, really wanted to welcome you, because usually that's what you say at the beginning, but now he's saying that he wishes the best of the rest of the stay, and that he congratulates the team for the success of the workshops and plenary sessions.
Tout a été, j'allais dire, parfait, sauf que Marseille, dans ses qualités d'accueil, en a une particulière, c'est celle d'être une ville de soleil. Or, le soleil n'a vraiment pas été au rendez-vous pour vous accueillir. Et c'est, je crois, le maillon faible de ces 3 jours que vous avez passés avec nous.
So everything was perfect, maybe except one thing, that Marseille is known for its sun, and the sun was not really here to welcome you. So everything was perfect except from that.
J'espère donc que vous avez pu profiter dans vos temps qui ne sont pas ceux de travail, que vous avez pu profiter des joies de cette ville, de sa qualité touristique. Et donc, j'espère que vous y reviendrez à titre personnel. Merci, bon retour chez vous tous et à une prochaine.
So he hopes you enjoy the city and all its touristic qualities, and that you shall come back. And I'm adding is, you have a few books about the health in Marseille, that if you want to practice your French and see all the not touristic things that are going on into the public health in Marseille, you can take it at the end. And he wishes you to come back soon.
Merci à toi.
Thank you, Patrick Padovani. Thank you for welcoming us. I will now pass the floor to Madame Laurence Auer, who is Director of Culture, Education and Research in the Ministry of Europe and Foreign Affairs in France. She was trained in Langues Orientales School. She was once head of the Institut Français, promoting French languages in the world. As she is a diplomat, worked as ambassador of France, as member of the spokesperson of the European Commission, as advisor to 2 foreign affairs ministers, and clearly she has an extensive experience in languages of the world for international exchanges. I asked her to say some words on the diversity of languages and multilingual awareness as tools for communication, advocacy, transmission of messages, education. Chère Laurence, the floor is yours.
Thank you very much, dear Yves. And ladies and gentlemen, it's my great pleasure to be here for the closing session of your Marseille big meeting. And I'm very much impressed by this organization, Mr. Deputy Mayor, as well. I thank the organizers because it makes this city, Marseille, a really important center. Marseille for us is as well the headquarters of IRD, one of our main research institutes in charge of research abroad, pluridisciplinary. And fairly enough, my friend Yves, otherwise I would never have accepted, asked me to do this closing speech. I'm supposed to be inspiring you about a topic, plurilingualism, maybe the use of different languages in public health sectors, as closing remarks of your Congress. And I really much hope that it can match all the sessions you have had and you see it as an added value. My work today dealing with education as well as culture, research, is really looking like building bridges. For a long time I was in charge of environment, so when you are a diplomat you are mainly a mediator. You go from one country to another. You also try to build from the national image something which abroad can develop into cooperation. And I'm in this very concrete phase in this directorate where we build programs. We build mainly a new education strategy with all our French schools abroad. When I was asked to speak about French languages, it really matched my political agenda. For the last 2 years, we've been working under the instruction of the French president on a big strategy to promote again the French language as a world language. In the international strategy, it looks very weird. We never had such an instructions to set up a language strategy. Usually, when you are in France, you internationalize your own program. You work on different aspects thematically, but as a whole, when we have proposed this 55 measures to the president to discuss about why languages are in the heart of influence and in the heart of cooperation, it questioned a lot to French diplomacy, and I think it questions as well a lot into Europe. Whatever Brexit or other political happenings could do, pluralism is something I want to elaborate a little bit, because if you take France, you see, ironically again, that building French language, it was the Edit de Villers-Cotterêts, was structurally the fundamental act to create our country. It was throughout language that our nation existed at some point. So you would maybe have imagined that within Europe we would have taken seriously this concept. So what's the role of a language in a society? What does it can be useful today for political reasons, for instance, to rebuild the notion of Europe today? We realized throughout European history that it didn't really matter. When we took, for instance, the education sector, we had an indication that at the age of 10, each kids should, but it was not compulsory, learn 2 languages in secondary schools. It never was really taken seriously, and today, as a result, you see that we have a common language, which is a tool. This is the English language, but how do we promote plurilingualism, and how do we promote an idea of the use of languages, and how we analyze languages as a key element of our common structures and our countries as well. Quite famous linguist, Barbara Cassin, just entered the Académie Française 2 weeks ago, stressing for once that the role of a language in a society was so strong that it could shape a personality. The language you speak is not only a tool or whatever you can imagine in terms of place into well, it is a way of shaping your sociology, it's a way of shaping yourself and shaping a country into the world. For France, strangely enough, language was a very cultural concept. We defined ourselves, defending French language was a way of defending cultural diversity. You know, we entered into resistance against uniformity, and we thought that going against one language was a way of respecting the diversity of the world and the diversity of the cultures. This was the Jacques Chirac period, and when we created the Musée du Quai Branly. Today the situation is quite different, and I will come again about this present period and why it is so important to think about it. One of the first acts of President Macron was to put into the public scene an initiative which was called Make Our Planet Great Again. You know it, everybody knows it. It made really a big, it took a very big importance into the period. It was during very tough discussions in the climate change convention, and it was an initiative in English. So it is not that we in France have a kind of dichotomy, a kind of paradoxical situation where we struggle for the French language everywhere, and then we decide that we launch an initiative 100% in English, even including in Africa, because it has development thanks to IRD. In Africa, we try to have now a very big entry in with climate change with the research. It's an initiative called Arise, so again in English. It is a kind of a situation where we decide that the language has this importance, but certainly we need to take it outside from the French conception, so outside of the culture system. So in 2017, we decided that French language should be seen as a language of technical and scientific knowledge. And that's where you come, that's where you arrive. We suddenly realized that beside the Proust and beside the French language to learn literature, culture coming from tourism, we had a fixed image about our language which didn't correspond to what we wanted to be and to express into the world. So we wanted to decide that French language would be important in the digital world, whereas today it has only the 4th ranking on internet after Chinese, of course English, but also Spanish. So strangely enough, the French was not seen as a technical or scientific or digital language. But also we tried our best to work it out as a language of innovation. And about that, leaving Europe, we started to work with the Canadian, our colleagues, who were much stronger on us on all those discussions. Why do I tell you about all those elements? Just to arrive to the point where my friend Yves wanted me to arrive. Languages give sense to action. Languages gives pluralism. Languages are necessary for the future, not only for keeping the French language alive on internet, but also to produce sense, the sense we mean, and we need on all the elements of the societies we are building. Today it's not a surprise if in France the health carnet is being done in 17 languages. It's because of refugees, it's because of students, it's because a lot of our society which has become internationalized. All we know about globalization of higher education also is an incentive for us to realize that we have to keep pluralism in languages, because otherwise we will lose little by little the meaning, the contents in the different various senses of what we are building as a knowledge, but also as a technical and indexation. And I think it is this kind of thing the French government would like to push about. So to finish with, we just finished a week in UNESCO. You know, UNESCO is this big forum in Paris where we welcome, as we do in Marseille yesterday and today, so many people coming from abroad. And as well at UNESCO, we're not seeking at imposing our views about what should be done throughout the world. We are in this process of opening Paris to cooperation on all those topics. But one of the big discussion which was taken at the General Conference this week was this. The world of internet, the world of sciences is getting less and less rich because it uniforms itself throughout a lot of factors, and we should be aware of that. We should also be aware that the complexity of our societies are something we should keep, and part of it are languages. Thank you very much.
Thank you, Laurence. So clearly, languages are an issue, and multilingualism is an issue for exchanges for the future. And this is not promoting specifically one language, it's about having many, many languages to exchange. I will pass the floor to Charlotte, who will challenge us on the conference as a deputy mayor in charge of health in Ville de Rennes, with 200,000 inhabitants. What did you get from such a conference, which may be useful for your daily life?
Thank you, and thank you so much for giving us a possibility to talk. So I'll talk about, as Deputy Mayor of Rennes in France, and also as a political chair of WHO Healthy Cities in France, and member of its political vision group in Europe. So I think we've been through local to global all these days, and I'd like to be very thankful to Hans Klug and Santino Severoni to have talked about WHO Healthy City on the main floor, which is not always the case, and that we see that cities diplomacies is raising. And it's raising for good reason. It's because we have to have things done when we are facing human dramas and all the tragic events, all the poverty, all the consequences of political decisions at European or local or national level. We are facing, we are dealing with it every day. And the WHO Healthy City Network has something kind of paradoxal, but also strong, and I think I heard it in many of your presentations, is that we are a political network. We said that health is a political choice, and it has been said, but we're not from a political party, and we belong technically to two sides of the political prism. But yet, we are facing the same thing. We want to build bridges. We want to address inequities. We want to work on the basis, on the values of public health, of the values that have been announced 40 years ago through Ottawa, through Alma-Ata, and going on and on. So, 1,500 cities and raising in Europe, which is not as many as the participants in this conference, 2,300, even a little bit more, which is amazing. And I want really to congratulate the team and the city of Marseille, which I think the attractivity, it has been said, has been a big part, of course, because it's a WHO healthy city. But I would not blame on the rain. I think at the opposite, it was a good determinant for having you in the room and not having you walking around. So maybe sometimes rain is a positive impact and not the opposite. I was not able to be here the 3 days, so I'd like to thank Zoe Heritage, the director of Healthy City. She gave me also some notes so that I can relay and see the ongoing work on those days. Something that has been sure and that people have been telling me is that the Congress, apart from the scientific part, apart from all the research and all the bridges, is about people. It's about people being happy to get together. It's about people being happy to get connection that you would never have in other opportunities. And it's about conviviality. I heard you had quite a great dancing yesterday. And this is about health. It's about walking the talk. It's about having a way of addressing each other that we can talk about the same thing and be equal and low down the vulnerability, and especially when you have places where you have people with high power and people with less power. I think, and I have the feeling that on those few days, students could talk with high-level representatives on an equal way. And this is so precious. And this is how we are going to raise the next leader to face the huge challenges that we are addressing, such as migration and climate change. We also, in a way, are addressing cultural determinants, and I'd like to mention the good moment of having the museum exposition on migrants from Afghan, from their art, which is also a way of saying culture is a health determinant, and is so important in all what we do, and that we have to address this mental health also in positive determinant and not only on all the catastrophes that we are saying. During the pre-conference session, and a little bit also on the sessions, I could see that the need for health in all policy was really raised. We have been talking about that, at least for the last 6 years, a lot. but we're beginning, from my point of view, to see it more in actions, to see more concrete way of having complex indicators to address healthy urban planning, health impact assessment, evidence-based policies, and making this health in all policy not only something we say as politicians from a stage, but something that's implemented, something that's evaluated, and something that's scaling up within all our different networks. And it can be in primary healthcare, as well in health SITI, or in the migrant and social worker. Zoe suggested me, and I think that's a good thing, that everybody is thinking, we have to think out of the box, we have to think about the box. But as Albert Einstein said, if you are looking for different results, you not keep doing the same thing. And how can we do new things? In order to build those bridges from researchers to policymakers, one workshop was really interested and mentioned by many people. It was the elevator workshop. Like, how do you brief a policymaker in 2 minutes in an elevator? It was really a way of saying things differently. And from my experience, it works. It's really sometimes I had, especially one budget I won in the elevator with the mayor of my city. So new ways of doing it, new ways. We did not have so many workshops that were not sitting and someone speaking, but how can we do something really new? How do we build bridges with people with disabilities? I mean, if we had someone in a wheelchair, he could not go in the stage now. How can we walk the talk and get the population we are working with in the room? How can we get the migrants, and we had them on the plenary session, the health workers, the psychosocial counselors on the YouTube. But how can we get them here so that we can exchange with them? How can we say that we walk the talk and get the people from the mental health council in the room so that they can also challenge us and challenge the science and challenge the policymaker, saying, yes, but we have different ideas because we are in our box. It's a big box. It's a very complex box and with many things. But I think we could go further. That's, I think, the first challenge I'd like to give for next session. How can we go further on health democracy? How can we go further in having adaptation for blind people, for deaf people? Not maybe in all the workshop, but a little bit more than what we've seen today. Another point is, and I'm go to the political point, how do we address commercial determinants? How do we address political determinants? Nobody asked the Director General of Health of France, Jérôme Salomon, and with all the esteem I have for him, how he reacted to the cut by French government of the help of Aide Médicale d'État, the help for migrants, for health, which is all the associations of public health, all the doctors are saying how catastrophic it is. It's hard for me to know he was on the stage and was not challenged on that. How do we talk about what's going on with the lobbies? Because we have all these studies showing how bad the alcohol is, how much it costs us. I mean, in France, it's like more than 50,000 deaths a year. It's 6,000 euro per person. But then, when Public Health Association want to make dry January, the president himself says, oh no, because the lobby of alcohol sellers is stronger than we are. And this is something we have to see how we address that, how we make communication. And we are beginning with the association, but I think we can go higher and empower, make public health great again. I don't know, like having a stronger voice and talk to the other people, because this is bad things that are happening. And this is things that, from my point of view, are endangering the future of my kids. So that's something I really wanted to say. Health is a political choice. How do we make the next step of public health showing this political choice and across the bridges? How can we go from bridges even to archipelagos? That's not saying we're building between islands, but saying we have the same basis. You know, archipelagos, they are linked by the earth itself. With democracy, with inclusivity. Also, my last point is, how do you get health people to be politicians? For myself, I'm in deputy mayor and head of all these networks only for 3 more months because we have elections in March and I'm not running again. But I'm really willing to, if you want, to empower and mentor and share all my political work in order for you to get elected and you to be the next leader and have health mayor all over Europe and have health president and health chair of region and put health higher on the agenda by sometime addressing another last determinant, which is power. Thank you.
Thank you, Charlotte. So we will now stop this panel. Thank you very much to our guests. And I will give the microphone to Martin Mackie for the last part of the meeting.
Well, thank you very much indeed, and that was really inspirational. Charlotte, I think that there will be many cities represented in the audience who will be very happy to elect you to be a mayor in their cities as when you move on from Rennes. So it is a very happy responsibility for me to be able to give some awards and say some thanks. And this is the time when we present the 3 awards that we give out at this conference. So we have, the first prize is the Best Poster Prize. And if we could invite, if they are here, Alessio Carradi from the University of Torino, University of Turin in Italy, who has been awarded the Best Poster Prize of 2019. And is Alessio here? Thank you. Another photograph, okay. And I should have said, actually, because I forgot to say what the poster was, influenza vaccine among future healthcare workers, a cohort study in Italian medical students. So, congratulations. And we now move on to the Best Abstract Prize, and is Melanie Deschazaux from INSERM here? The Best Abstract Prize is for a paper entitled Nutritional Quality of Food Consumed, graded by the FSAM NPS Nutri-Score and Mortality in Europe. Melanie, congratulations. But stay here, because I'm also delighted, and this is a prize which is particularly poignant for me, because we also award the Ferenc Bojan Young Investigator Award. And if you will allow me to digress for a minute, Ferenc Bojan was a very close personal friend of mine, a former president of UFA, a Hungarian public health researcher, and was really the person who drove forward the transition of public health in Hungary, both as an academic and as an advisor for policy. And tragically, he became one of the statistics that those of us who have researched that part of the world study, because he was killed in a car crash a number of years ago. And in recognition of Ferenc's enormous contribution to UFA, but also to public health in Hungary and in Europe, we award a prize. And you have won that as well. So, congratulations. There we are. Thank you very much. We've got the photographs. Okay. Okay. So we now have, I now have the great pleasure to say some thanks to people, and if I could invite Dineke and Alita Auer to join me on the stage for this. And Dineke, maybe I could pass over to you to tell us why you're here, why both of you are here.
Thank you very much. Is it working? Yes. Thank you very much. In 2000, the youth office finally became a real office and moved to the Netherlands. And in my office, I found this lady, Alita Auer, For 19 years, she has been a great advisor, friend, and also reorganizer of our conferences, making the conferences more structured, as well as making the conferences greener. And she has been behind the scenes for 19 years. So, Elita, your moment.
Yeah, a good organizer is always prepared, because you never know. But you almost mow the grass before my feet. How do you call it in English? How nice is it that when you have organized the very first UvA conference together with the founders of UvA, Louise Gunning and Jouke van der Zee, in Maastricht, 1992. Note, it was a half-day meeting. And years later, based on the experience my office had gained, I was asked to advise on the reorganization of the total organization of UvA, now EPH conference called. It was growing, structure was needed. Dineke and I started together, and in the course of a few years, a fantastic team, Floris, José, Jessica, Robert and Lydia, is working on the practical part of this conference. They have an answer and a solution to every question and topic. Management, manuals, agreements, PR, press information, overviews and terms and conditions, rules and regulations have been written. It's a lot. And the conference is still growing. Now it's all arranged. It's time for me to stop. Thank you for your support, kindness, and I will miss you all. Thank you.
Thank you, Elita. Okay. And I have... Oh. J'attends. I have one more person to thank. Yves, could I ask you to join me on the stage? Yves? Yves, s'il vous plaît. Yves, merci beaucoup pour cette conférence extraordinaire et merci également à votre équipe, excellente équipe. When we put together this conference, and when we had the idea, notre objet était de créer to créer des ponts avec la santé publique. Les dépontes entre les peuples, entre les pays, entre les disciplines et comme nous l'avons entendu cet après-midi, entre les langues. Vous avez réussi. Congratulations, felicitations.
Merci, Martin.
Thank you very much. And nous avons un petit cadeau for vous.
Thank you.
Thank you very much.
Merci.
I'm always hesitant to do that. I'm always reminiscent of Churchill's words whenever he was speaking in French, when he said, Prenez garde, je parlerai en français. So you will forgive me if you actually do speak French. So thank you very much to that. And my next duty is to invite Carlo Signorelli, the co-chair of the 13th European Public Health Conference, to tell us about Rome in 2020. Over to you. And to Anna Adone.
Yeah. Thank you very much, Martin, and congratulations to Yves and to French Society of Public Health. We are here to present the next event in 2020, which will not be a standard European conference, because it will be a World Congress in Public Health. Basically, we ran together the European Conference, the Italian Conference in Public Health, and the World Congress of Public Health that take place every 3 years. We have prepared a video, short video, to present the event. But I would like also on behalf of Professor Ricciardi, that had to move for logistic reason and is co-chair with me, I have my young colleague Anna Done. I would like to ask her to say a few words, and she's here also to give a message that we try to attract young professionals as much as possible in Rome as was in Marseille. Please, Anna.
On parlait des langues tout à l'heure, donc la communauté italienne de santé publique et le comité de Rome 2020 remercie la ville de Marseille, remercie la Société française de santé publique, les institutions, le cher ami Yves Charpak et vous tous pour avoir organisé cette belle conférence. On part dans le soleil d'être resté, je crois qu'en Italie. Et on vous attend tous à Rome l'année prochaine. On a beaucoup partagé cette semaine. On a discuté, on a appris des choses en santé publique et on espère de faire la même chose avec vous en Rome. La ville de Rome vous attend et on vous attend tous. On espère d'avoir la collaboration, l'aide de la communauté française de santé publique. À bientôt à Rome. Au revoir.
Rome, the city of the eternal beauty, vibrant in her mysterious charm. The sun painted her light, man created her shape and her history. Crossroad of destinies, capital of Italy, museum of the world, that inspired poets, artists, thinkers of all times. Center of the European political life, the city where big decisions are made. Here, after a long gestation, in 1978, the National Health Service came to life, focused on universal health coverage, solidarity and equity. It is one of the most virtuous paradigms in the world, focusing on diagnosis, care, but also prevention procedures such as vaccinations, screenings and health promotion. The 16th World Congress on Public Health, October 2020. Once again, Rome will be an open-minded space that will host an international community offering an incomparable cultural heritage, a warm welcome and the excellent taste of Italian food. Thanks to their proven expertise, the three associations are developing a rich program on different topics with plenary sessions, workshops, world leadership dialogues and much more. The breathtaking design convention center La Nuvola will host thousands of delegates from every corner and culture of the planet. We're ready to face the dawn of new challenges, committing and working all together. The time for a new scientific and human enlightenment has come.
Be there to make the difference.
Be there to make it happen.
Okay. Thank you very much pour la dernière fois. Yves, s'il vous plaît. For the last time, Yves Charpak will join me on the stage. To say goodbye.
So, just to say goodbye, thank you very much for being with us. It was really, really a very, very nice meeting, active. We had to learn too much, as usual, but we go back with new ideas for moving further, and clearly for getting to next year, which will come very soon, in Rome for discussion on public health is a lively activity.
Thank you very much indeed. Thank you all. Goodbye.